I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over the top 3 exercises you can do to eliminate headaches. So for those of us with children, it is about that time of year where they're going to be staying home a little bit more. And not that I'm implying they can lead to headaches or anything, but it also is time of the year where travel increases, sleeping in different beds, cars, airplanes, become involved, and that can cause an increase in headaches. So in the summer months with the pollen, allergies, things like that, we do see a lot of more headache instances in here. So I want to go over kind of 3 things you can do to really nip that in the bud. And one of them is, we always go back to it, posture. It's always about posture. And I get asked a lot, a lot of you talk about posture, and I'm kind of tired of hearing you talk about posture. And then some people are like, I've never heard you talk about posture. And unfortunately, what people have to realize is a lot of what needs to happen is changes to their lifestyle, changes to how they sit, changes to how they use their phone. I always have the conversation with new patients that, when you come in here for an hour a day, if you leave here and spend 23 hours a day messing up what I've just spent an hour trying to undo, you're going to win. So it's not a battle you want to win, but you will win if you, don't change your habits. A lot of times, most of the time, what we see in here is things that are due to posture-related issues or overuse or things like that going on in your everyday life that cause the pain, cause the joint issues, cause the headaches. So when I talk about posture, and for those of you who follow us know that it is a big education point of mine, it is really important, because if you go and you spend the time to be treated and you don't work on things outside of treatment, and I'm not talking about just doing some home exercises, because while sometimes they are important, it is more important that how you sit in front of the TV, how you sit in front of your desk at work, how you stand in front of your desk at work, how many hours a day you use your phone. And you'd actually be really surprised at the numbers on how often we are on our phones throughout the week. Those minutes add up to hours by the time we reach a Friday. So you really want to be cognizant of posture when you are not in here, or you're even out at your desk or things. So one of the big things that causes headaches is tension in the neck. So this posture when you're doing your phone is a really, really good way to cause a headache. It winds up loosening up or stretching out a lot of your muscles in your neck, which you would think would be really good, but it actually weakens them. So you wind up with this very much posture that's like this. So things are actually getting compressed and jammed, and then you have to, in order to do this, then you have to look up like this. So it really causes a headache to form at the base of that skull. So you'll get a headache from here, possibly even up into the front of your forehead. A lot of people call them a tension headache, but it's just from this looking down and then trying to have a conversation and looking back up and trying to have a conversation. And people say, I don't do it for that long, or, it's just while I'm waiting for my dinner, or things like that. Again, if you really add up the minutes and how often you do that during the week, it's hours. Your body was not meant to be in this position for hours and hours and hours. And then your shoulders are rounded forward. So everything is going forward. And you're actually winding up reducing the blood supply up into your brain when you're sitting like this. So you wind up with that oxygen deprivation headache too. So there's a couple of reasons why it is important that you watch your posture. What you want to do is you just want to roll your shoulders up, back, and drop them down. Now, so many times I do this, and I tell this to people, and I get this. And they're very rigid and very uncomfortable to even look at. And it's not the case. You don't want to roll them up, back, and just glue them back. That's actually in the wrong direction. That's going to injure yourself a little bit further. So it's literally just an up, back, and drop them down. Now, if you are someone who walks around like this because there's a lot of tension in your life, then you are going to have to do this 1,000 times a day, because when you're not thinking about it, your shoulders are going to go back up like this. So you're going to roll them up, drop them down, let them relax. 5 seconds later, check where they are. If they're back up like this, that means that this is where they have been taught to stay. So now you have to reteach them to stay down. So you just want to push your shoulders down. If you're going to do anything, you want to push your shoulders down. You don't want to jam them backwards. Okay, so push them down, don't jam them back. That's number one. So that's posture. Watch anything at your workstation, your phone, driving, that brings you into this posture. Sitting in the TV at night on the couch where you're like this, watch all of that. Again, that allows this posture to happen, which compresses everything, which allows those muscles to become tight, and you get headaches up into the front of your skull. The next exercise I'm going to show you is just a gentle stretch. So this is one of those things, if you wake up in the morning and you think you pulled something overnight, or you're sleeping with a different pillow in a different bed, you've been traveling, this is one of those ones you can just wake up and gently do. I recommend doing this in the shower under a nice hot water, just to kind of give it that extra heat to loosen up a little bit. You're just going to take your hand and gently place it over and give this a pull. Now, if you wind up leaning your head to the right and you feel a stretch down the side of your neck, you don't need to add the pressure of your arm, okay? You don't need to add the overpressure of your hand. But if you're here and you're like, I don't feel anything, you want to just gently pull a little bit. Again, as I always talk about when it comes to stretches, you don't want to pull too hard, all right? So this should not be uncomfortable, all right? This should be a nice, gentle stretch. If it hurts, then take the hand away and just hold this. You want to do this 30 seconds, and you want to do it 6 times. You want to make sure that the shoulder is pushed down, all right? So it's not this, and you're chasing yourself all over the place. Push your shoulder down and lean your head to the side. You're going to feel a stretch right in through here. Same thing on this side, all right? You're just going to tilt and then gently pull to the side. You want to get a nice stretch. Now, for me, this side's a little bit tighter, so I don't need to pull. I don't need to put my hand on top of my head. I can just hold this for 30 seconds, 6 times, and I'm going to get a good stretch. What you need to realize is that the more pressure you put on it to feel pain, the more you're actually injuring it. And what you can do is, if you're here and you hold it 30 seconds, and then you're like, I'm going to try my hand, great. Maybe you do 3 with, pressure, and maybe you do 3 without. It's not a big deal to have your hand up there and cranking it over. That's not the intent of the stretch. The final thing that you're going to do if you suffer from headaches is you are going to do the side stretch that we just did, but then you're going to drop your head forward a little bit, okay? So you're stretching more on a 45-degree angle. And then you're going to just put a little bit of overpressure there. You're going to feel this down the back of your neck. Not directly down the back, but going down more of the side/back, okay? Again, so you're going to bring it to the side and then drop it forward a little bit, just like that. You're going to hold that 30 seconds, and you're going to do 6 of those on each side. You're going to stretch it to the point of feeling a nice gentle stretch, not to the point of pain. All right, so here we go. Nice and easy. Same thing on the other side. Drop it down and then drop it forward. If you have a laptop that you work off of with work and you suffer from headaches and you don't have either a separate keyboard or a separate monitor, you are not going to get rid of your headaches. Okay, so there are certain things you have to be aware of. If you continue to hold your phone and you're like this on your phone, you're not going to get rid of your headaches. So if you sleep on your stomach and your head's like this all night and you wake up and you're like, oh, my head is killing me, you're not going to get rid of your headaches. There are certain things that you do throughout your day that if you don't stop doing, there's nothing any of these stretches are going to do to help you with your headaches. If you walk around and you're like all tense, drop your shoulders down. You can do a real quick chest. Try and drop your shoulders down. Try and push them down. Do you feel them go down? If you feel them go down, then there's a problem, okay? Then you have pain that you need to worry about, getting rid of, that you need to worry about correcting your posture. This does not fly, all right? This is not going to alleviate any headaches. So I don't care how many times you do those stretches. If you go like this and you're walking around all day, you're not going to get rid of your headaches. You're going to have to push your shoulders down and make sure they stay down there. And like I said in the beginning, it may take you literally 1,000 times a day of rolling your shoulders up, back, and dropping them down in order for them to stay there.